So today I want to cover a really timely topic, which is what to do with Ozempic, Wegovy and Mounjaro. So I get asked this question really frequently, and many of my patients have the urge to actually skip the shots around Christmas time because they really want to indulge and enjoy the festive season and don't want to have the side effects of those drugs if they overeat. So I will focus on the risk of stopping medication suddenly and eating too much during holiday season. And I will cover the questions that I get asked very frequently in my clinic. So the question number one, why should someone on GLP-1 actually avoid skipping doses or stopping the medication entirely? And this is really important to cover because there are different reasons why patients get put on those drugs. It could be that you've been primarily put on that drug because you have diabetes or you have metabolic syndrome, and the primary reason why the doctors has started you on the medication is to control your blood sugar levels. So if you stop or skip the dose, basically your blood sugar control will deteriorate. So your blood sugar levels will go up. If you've been put on those drugs primarily to control your weight because you have metabolic syndrome and to reduce your cardiovascular risks by reducing your weight, of course, once you skip the dose or stop the medication entirely, the effect of GLP-1 agonists will then wean off. So you will no longer feel the satiety you usually used to feel when on the drugs. So you will very likely increase your caloric intake. Second question, what can happen if you don't taper them more slowly or you got off them without warning? So I guess the tapering off and preparing yourself is a part of the therapy, and that everyone should discuss with their doctor in order to have the support how to go about the situation in such a manner so when the medication is being tapered off and it is the optimal situation for you, so you prepare yourself also mentally that effects of the drugs, once it's tapered off, will actually wean off and you will feel more hungry than you used to previously. So one part of the therapy is, of course, rewiring your brain and changing your habits of how you eat, how much you eat, and learning from the experience while you're on the drug in order to apply those changes and continue with the lifestyle changes you made while on the drug once you've been put off the drug. So the weight loss or the glucose control and your improved metabolic health can continue once you stop the drug as well. Number three, what happens inside the body and with your satiety hormones when this happens? So basically, once you stop the drug, you will feel more hungry than before compared to how it was with the drug. So basically, you go back to the baseline. So it is important to see the therapy in a very comprehensive meaning. Once you've been put on the GLP-1 agonists, regardless whether it was for your diabetic control and sugar control or weight loss or metabolic syndrome, it is important to know that it's not only the therapy that will fix your problem. Once you're on the therapy, it's really important that you learn to change your lifestyle, to change the way you eat, the way you think about food, and also your physical activities. And this is really, for many of my patients, really a good opportunity to change their habits with the support of the GLP-1 agonist. The next question is, how might it affect your diabetes? Of course, once you taper off the drug, once you skip the dose or once you stop the therapy, the blood sugar control is likely to deteriorate, so your blood sugar levels will go up. The next question is, if someone goes off the medication suddenly, what happens to their appetite? The very quick and simple answer is the appetite will go up. And does it go back to how it was before medication, or does it take time to adjust? It will most likely go back to how it was before you were put on the medication. And the other question is, what risk do people run into if they stop taking GLP-1 and then try to eat a large holiday meal or junk food or holiday cookies? Is it dangerous to suddenly eat large meals after going off those drugs suddenly? This is something I get asked really frequently. And here I just want you to apply common sense to the situation. So I just want to stress that regardless whether you're on the drug, off the drug, you've never been on the drug, it's never good for your gut health, for your digestive system, for your cardiovascular system to binge eat during Christmas season or any season. So large holiday meals, junk food, fried food, sugary food, never something I would advise you to do. Take a small meals, avoid fried food, avoid fatty food, especially at night. So the next question is if someone wants to taper off GLP-1, how should they do it? I strongly advise you to do it with your doctor. So consult your doctor who prescribed you the drug in the first place and make a plan how this should be done and when it should be done in order for you to get the best results and of the therapy after you stop the therapy as well. Don't regain the weight you are able to lose while on GLP-1 agonists. The next question is, what cautions should someone keep in mind around the holidays if they are on the GLP-1 drugs? There are foods they need to avoid or cautions. Yes, this is again common sense. You should avoid large meals, heavy foods, fried foods, large meals at night, sugar food. So basically, whether you're on the drug, off the drug, or never been on the drug, apply common sense. Fatty food, fried foods, processed foods, heavy meals, sugary foods, something to really avoid. You can enjoy the Christmas season by taking small portions of more healthy foods and still enjoy the gathering and the atmosphere of Christmas. So now I want to move on and talk about something really important, something that I get asked very frequently by every patient that wants to be put on GLP-1 agonists, have heard about GLP-1 agonists on social media. So this is diet and exercise guidance for patients taking GLP-1 agonists. And as usual here, everything we discuss is either my own clinical experience or it's based on science and evidence. So this advice has actually been published in JAMA in the year 2025, and it is how to follow the meal plan to maximize the benefits while you're on the drugs, while you're on Ozempic, Wegovy or Mounjaro. What shall you do in terms of your exercise and diet in order to have the biggest benefits of the therapy? So meal, what does meal stand for? M stands for maintain muscle. E stands for energize and balance. A stands for avoid GLP-1 side effects, and L stands for liquid for hydration needs. So let's start with M, maintain muscle. I want you to take 20 to 30 grams of protein, like fish, chicken, yogurts, beans. Second, protein shakes are also very helpful when GLP-1 severely reduces your appetite. So maintain muscle, it's about protein, and you can also use protein shakes. E, energize and balance. Snacks could be very important to you. Nuts, fruits, yogurt between the meals. And also the other thing you need to think about is slow digesting foods, such as oatmeal or sweet potatoes would be good for you, as well as healthy fats, olive oil or avocado. Now we're moving on to avoid GLP-1 side effects. Constipation could be a side effect, which you could increase your fiber and also stay hydrated. Nausea, please avoid fried foods and eat more whole grains. You can also try ginger. What about heartburn? Avoid spicy foods. Stay upright after meals. Stay upright after meals. This is something also that applies to Christmas season. If you had a large meal at night, do not lie down immediately. L, liquid for hydration. Drink 8 to 12 cups of water per day and eat hydrating foods such as soups, cucumbers and melons. So this is your meal plan, which is evidence-based, published in JAMA in the year 2025. Maintain muscle, energize and balance, avoid GLP-1 side effects, liquid for hydration needs. And the last part, which is also very important, and I get asked this question very frequently, is about the physical activity while taking GLP-1 agonists. So what can you do? What kind of exercise should you be doing while you're on Wegovy, Ozempic or Mounjaro? So I would recommend, and the data and the science recommends, aerobic exercise and 150 minutes per week brisk walking. Then also really important is strength training. 30 minutes, 2 to 3 times per week. You could do weights, you could do resistant bands. So again, keep it in mind, very simple meal, maintain muscle, energize and balance, avoid GLP-1 side effects and liquid for hydration needs. If you like this video, follow for more and watch the videos that we published previously. Happy holidays!